Helping patients with their mental health is crucial to many medical challenges and treatments. Our team from Clay County Medical Center shows us how a career in behavioral health uses empathy and insight to help at risk patients and patients in crisis navigate a path to mental health wellness.
Clay County Medical Center is a cutting-edge facility with a comprehensive and community-based outlook on healthcare. Our team is dedicated to improving the health of our communities by providing quality, compassionate care to everyone, every time. With the increasing need for behavioral health services, we recently constructed a dedicated mental health clinic. This will be the new home for our behavioral health team at Clay County Medical Center.
I love my job, and I'm very proud of what I do. So I come to this office and I try to read all my notes before I see my patients. And I make a note what to ask and how they do and things that I need to make sure to ask and make sure. And then I start seeing the patient at 9 o'clock, and that's how my day starts. During lunchtime and whenever I have time, I try to provide the consult, like somebody calls and asks for a refill, and I try to take care of it, everything as soon as possible for my patients. I took care of a lot of patients, not only with a medical health issue, but mental health issue. But back then, we only had one psychiatric provider. So I decided to take that matter in my hands, and then I decided to go back to school. Nursing takes special heart, and psychiatric nursing takes special and extraordinary heart.
My name is Matthew Myers. I'm a licensed specialist clinical social worker, and I'm the program therapist at Senior Life Solutions at Clay County Medical Center. We have individuals that have an admission here to where they start with the program. Our days consist of groups. It's intensive outpatient is what it's considered with those groups. And so Mondays, Wednesdays, and Thursdays, we provide group therapy for 10 individuals at a time for 3 hours for those 3 times a week. And also the people that do come for this program do get individual therapy 2 times a month. Really started off with a friend asking me to work at a facility in Newark, Nebraska called Airport Village as a group home for boys. And this is when I was in college, and so it was a summer job that I took as part-time, and that started off my mental health career. That was back in 1993. That led to working at other group homes in Nebraska, a total of 9 years, and landed a job as a case manager here in Kansas. And so I worked that for about 3 years, went to a position of being a supervisor for those case managers, felt that my career needed to be furthered from that, and so I went back to school after 14 years of being out of school, and went to Washburn to get my master's in social work. So I graduated in 2012 and continued working at a community mental health center as a therapist, and I became a supervisor for those therapists and other types of jobs there. I got my clinical license in 2015, and looked at different career paths and decided to come to the Clay County Medical Center to work as the program therapist at Senior Life Solutions. Yeah, so there's a lot of training around self-care. One advice I give to new therapists going into therapy is get your own therapy. Seek out your own therapist to get that self-care going, and because it can be very trying.
We're outpatient psychiatry, so we have patients come into the clinic just like you would go in for a doctor's visit. They come in and talk to me about how they're doing, how their medications are working or not working, side effects, a little bit of psychotherapy, and then schedule follow up based on how they're feeling, and then they come back and see me. So anywhere from like a quick 10-15 minute visit to an hour and a half, depending on what's going on. Typically a day would look like seeing patients around 9, having a lunch, and then getting off by 5, going home Monday through Friday, no weekends, no call, anything like that. Averaging, I would say, about 8 to 10 patients a day. I love how the brain works. Initially, I got into this field through geriatrics and memory care, and when I went to school, it was across the lifespan, so then kind of found the love for pediatrics and adults and all that. It's very rewarding to be able to help people and just, help them feel better so that they can enjoy life, and yeah.
Welcome to Clay County Medical Center, our family caring for yours.
I want to welcome our panel of behavioral health experts to answer questions about the career opportunities in behavioral health. Joining us this morning from Clay County Medical Center are Matt Myers and Heather Trombley. Good morning.
Morning.
Well, I'll start with a couple questions before we turn it over to the chat. Wanted to ask you both, what is the most rewarding part of your job? Let's start with Heather.
Definitely the most rewarding part of my job is helping people feel better. People come to you when they're not feeling well at all, and after a couple of months, being able to have them come in and tell you that they're enjoying life, enjoying their family, enjoying their career is very rewarding.
What about you, Matt?
Yeah, I agree with Heather. Watching someone come in to our Senior Life Solutions program, seeing where they're at, where their start is, and the progression that they make, it's a really amazing. It's really amazing to see the outcomes of the progress when they work towards their goals, working towards the treatment that they receive, and seeing how they see there's a better way of living in their lives.
So I have another question for each of you. We'll start with Matt this time, but is your position more of a team job, or do you work more solo?
It's very much a team job. There's 3 of us that work in the office. We have a patient coordinator, and we also have a registered nurse on our staff. And so we all work together to provide the best care for the patients that we see. Getting the holistic treatment of medical care, medical monitoring, and then also the mental health component, you can really see the effectiveness of the team aspect with providing these services when it comes to our program.
What about for you, Heather?
So for me, it's a little bit of both, honestly. So I see patients just individually, one-on-one, but then we have a whole team who really works to manage medications, refills, appointments. If somebody's having a side effect from a medication, they'll call in and talk to my behavioral health tech. And so outpatient psychiatry is a little bit different. There are plenty of providers who do work individually, but in my particular job, it's definitely more of a team. And then we also have other psychiatric mental health nurse practitioners. So if I'm having trouble with a case or needing to debrief or things like that, I've got people that I can talk to.
So for both of you, what kind of advice do you have for folks starting a career in this field? And we might have folks, middle school, high school students, as well as college students and adult learners. So if someone's thinking this area of behavioral health might be something they're interested, what kind of advice would you give them, no matter what stage they're in? And I can start with you this time, Heather.
So I would say the behavioral health field is so vast. Really find out what you enjoy. So if you enjoy the sciences and you think you want to maybe really focus in on medications and pathophysiology and the brain and anatomy, maybe you want to go more the nursing or the medical side of things. If you really enjoy the social aspect and the social sciences, really providing, that whole picture, that whole socioeconomic picture, then maybe you want to go more the social work side. So I would say just getting experience and kind of understanding what area you enjoy and then pursuing that route because it is such a big field.
What about you, Matt?
Yeah, I think find those providers that are out there, talk to them, see what they do. If you're in college, you can look at maybe a position at a mental health center working with children or adults, and to kind of get your feet wet in that field to see what it's like to see to understand the mental health, behavioral health piece of it, how to work with individuals and see that's something that you would enjoy doing and furthering, because you just don't have to stop there. There's so many different areas uh, of this field that you can go into. So there's a lot out there to be offered.
Well, I imagine with so many folks joining us today, we have some questions in the chat. So I'm going to ask my colleague Jaron to take it over from here. And what kind of questions do we have, Jaron?
Well, we'll first start off with a question. We've gotten several that really want to, again, clarify what does some of the, timing take for your licensure certification. We know there's a lot of different roles under the mental health, behavioral health umbrellas. And so maybe both Matt and Heather, could you again just remind folks your role, how long did it take for you to get to the point of licensure or credential? And if you are able to share with some of the other roles that exist within the behavioral health sphere, what might some of those educational timelines look like, just from a length of time perspective of training? And Matt, if you would like to start, and then we'll jump over to Heather.
Sure. So the path that I took was a more non-traditional role. Like you saw in the video, I was out of school for 14 years before I decided to go back and get my master's. My undergrad is in biology, actually. And so I had to start kind of fresh and go through a 2-year program to get my master's in social work. And I was working full time at that time. And so I was not taking it all full speed. I kind of dip my toe in the water to see how I would do with going back to school. Once I got that all figured out, I went after it. And so it took me about 2.5 years to achieve my degree in social work. If you're a student that has a bachelor's in social work, you're considered to be an advanced standing student, and it only take a year to achieve that master's in social work in that graduate level. And then after that, when you graduate, you have to take a licensing exam. And you have to pass that, of course, and then you'll be licensed as a licensed master social worker. You can continue on from there. You can go through the clinical supervision process to where you have to have at least 2 years of clinical supervision by a licensed clinical social worker to achieve the standards of getting the supervision, seeing individuals, assessment and diagnosis. That's all part of that process. And once you do that, you have to take another exam for your clinical licensure. And then you can further on with that. So that clinical licensure is what's considered to be an independent license, to where you can provide services out in the field on your own.
And Heather, for you and your timeline and process and degree that you have?
Yeah, so I'm kind of similar to Matt. I am a psychiatric mental health nurse practitioner. So I started my education path for my bachelor's of science in nursing and did that for a while. And then after some work experience, decided that I wanted to go on and pursue my master's degree in nursing, specifically psychiatric mental health. So it took 4 years for my bachelor's degree in nursing, then worked for a while. And then it was another 2.5 years to get my master's of science in nursing. Have to take board certification at the end of all of that. There's also doctorate in nursing practice that would allow you to do this. That would be more about 8 years versus the 6.5 to 7 years for your master's in nursing. But I mean, if you were interested in the nursing side of things, you could work in the mental health field with possibly a CNA or a CMA. So 6-month-ish or so certification all the way on up to 8 years of school. So really just depends on how involved you want to be, and how much school you want to go to. But there's really anything from entry level to doctorate in nursing.
And another question, Heather, while you're here, someone's asking, what's the difference between a psychiatric practitioner and a therapist, if there is one?
So a psychiatric nurse practitioner, we prescribe medications and we also provide psychotherapy. So a little bit of both. Where if they're talking therapists like what Matt does, that would be the therapy side of things without the medication piece of it.
Okay, that's very helpful. Thank you. I heard Matt, you mentioned in the video, you need your own therapy sometimes, you need your own self-care. And for maybe you both, we've gotten a lot of questions. What's the hardest part of your job? How do you manage the toll? Would you both share? Because I'm sure there is a toll. What does that look like? And what are your tips, or how do you cope? How do you manage working in this field and coming home day to day? And Matt, if you want to kick that off, we'll start with you.
Yeah, a lot of it's just self-care. Being able to manage your time is a big part of it. When you go into the behavioral health field, you are working with people, but there's background stuff that no one ever sees, like getting your progress notes done, filling out forms that need to be filled out, looking at different what you're going to do for that day, all these different things that are lined up. And so there can be a lot of pressures. There's deadlines you have to meet. And so you want to make sure that you're taking care of yourself and finding ways to do that, finding systems that work for you at the job, using tools. I'm very skilled as a therapist, I believe, but my grammar and spelling is horrible. So I use Microsoft Word to find the errors in my note writing, and so I find things like that to make sure I provide the best quality services and have those outcomes of those services out there. And so finding ways to take care of yourself can be a big thing. And then you take on a lot of the emotions of people that are there. If you're not careful, you can have what's called secondary trauma, to where you are feeling the same trauma as the person that you are working with. And so you hear some pretty rough things at times as a therapist. And so you want to make sure that you're taking care of yourself, and seeking out an outlet for you to express those emotions, those feelings, those struggles that you're experiencing.
Heather, anything else you'd want to add from your perspective on that, managing it?
Yeah, that I'm not very good at it. That's the $1,000,000 question. And so for me, it definitely comes down to self-awareness, and practicing what you preach. So you're constantly talking to your patients about setting healthy boundaries, making sure that their priorities are in, that you're focusing your time on your priorities, and then definitely having a support group. So there is a group of PMHNPs that we support each other. And so I would just say being very self-aware and knowing what your boundaries are and what your limits are. And if you find that you're out of sync with those, then making a correction.
Thank you both for that. And we're almost to the top of the segment end cap time, but want to leave with this one. Somebody's asking, how might I go about shadowing or trying to seek out an internship? And so maybe number one, can someone shadow you or other practitioners in the behavioral health space? And also, what might be your advice for if there are folks after today that would want to shadow or maybe even pursue an internship? What might you tell them to best navigate that, to hopefully get some of those opportunities? Heather, would you want to start?
Sure. Yeah. No, I have students all the time. So students reach out, and we precept all the time. So it's definitely something that you can do. I've had high school students who follow for just, a day or two to see kind of what it's like. And then I have nurse practitioner students it's a requirement of their program and they have to get a certain amount of hours with me. there are obviously certain things that they have to do to make sure that they're HIPAA compliant and things like that. So they'll work with our office manager, but absolutely shadowing is something that's available for all levels.
And Matt, anything else to add, or would you echo that?
No, just call the agency that you want to shadow and see what the policies are around that and see what opportunities they have. I really recommend that if you are going into a field like this, part of the program of that is to have that internship and to have that practice in that field to know what it's like and to have that experience to build on the skills that you're learning at that time. So there's a lot of different avenues to look at how you can come into a facility and look at what an eye of what it's all about. But the internship through through a course that at a university would be a really good way of going through that.